Okay, good afternoon, everyone. I think it's worth starting. I'm Fiona Schaefer, and I'm one of the innovation managers at Inniscott Health, and I'm joined today by my colleague Francis Ramsey. First, a couple of housekeeping points. This session's going to be recorded, as you can hopefully have seen and got the alert, and it's going to be available to watch later on our Inniscott YouTube channel, so do share with colleagues. If we will have time for questions at the end, so if there's anything you want to ask, please put it in the Q&A or use the chat section on Teams. We'll be sharing a link to our feedback form towards the end, and we certainly really appreciate your comments, ideas for future topics that you'd like us to address. So far in the series, we've been looking at the innovation landscape in Scotland, where to seek support, some practical advice on intellectual property and how to navigate the regulatory pathway. All these are available on YouTube channel, including the last one, which was hopefully gives you inspiration and innovation from innovators Debbie Wake of My Way Digital Health and Tamsin Holland Brown, the Clinical Entrepreneur Programme. So today I'm going to start a little bit about who Inniscott Health are, sort of the support within the NHS for innovation, and then onto the main focus of today, which is all about ideas and how you can describe and what to do next, basically. So we were established in 2002 to protect and commercialise NHS intellectual property. It's very much a unique role that we have in unlocking the know-how of NHS staff to improve treatment, patient care, very much making a difference to across Scotland and beyond. We're partly publicly funded from Chief Scientist Office, involved with setting us up back 21 years ago, and we're very much about focusing on the commercial strength and health economic benefits of an innovation and idea, and I'm going to talk a little bit more about that because we're looking to generate a financial return to the NHS and innovators. And some of you may know us in our previous incarnation of Scottish Health Innovations SHIL, so with the same organisation with the same remit. So how we're adding value in numbers, we receive around 100 ideas a year, and so today we're focusing on that, really what starts. How do we assess how do we work out and look at what's a good idea, how we might take it forward. Currently holding equity in 6 spin-out companies, where we manage that equity on behalf of NHS health boards, with a prospective value of around 15 million. And one of the key ways that we'll commercialise spin-outs are very much about where you need to get additional investment, and it's maybe a longer journey to commercialise an idea. Commercial license deals are where we would develop a project, show proof of concept, and then we'll license it to a company who can make and sell the product. So earlier this year, we commissioned a survey of NHS staff, and it shows it's a really supportive innovation community in NHS in Scotland. And that's innovation is recognised as being important to improve our services, and with 61% think it's really important. And findings in terms of the ability to contribute to improvements is that you see yourself as innovators. Most people see themselves as a healthcare innovator, solving problems day to day, and many of you that having ideas to improve how healthcare can be delivered, to make things easy, make work easier, make a difference to patients, and enable us to do more things better and more efficiently. So one of the things we've been trying to help focus as part of our kind of that inspiring you to innovate is coming up with a series of innovation calls which are aligned to the NHS Scotland's strategic priorities, and achieving net zero by 2040 is going to be no small feat, and it's like we anticipate that, among others, is going to be a key driver of innovation. So we've put a number of these innovation calls together to help focus the mind and encourage you to come forward with ideas in these kind of key priority areas. Another is pregnancy and perinatal, which is in line with the latest Women and Children's CSO NHS open innovation call that you'll have seen out now. Others have been frailty, eye health. You can find out more on our website. So today we're going back to the start, at the beginning. You've got this idea, so what do you do? What do you do next? And we're talking about what makes a good idea. What sort of information are we looking for to be able to assess that idea? And first thing that we're looking at is, we only have limited resources, and we're looking at, how can we make it? How do we focus our effort and our support where it's most needed? And we'll start off by looking at, does the innovation come from NHS Scotland Health Board? Is the NHS involved? Is there any intellectual property or know-how in the project or going to be involved, or it might be generated? If there is, or it comes from an NHS member of staff, then we look and explore that innovation in more detail. And that's often quite an iterative process. We need to find out a bit more information. So with around 100 ideas that come to us each year, we're only able to select just under 10% of those to progress along our innovation pathway. But we also have very strong networks well embedded in the innovation community in Scotland. So it might be more appropriate for you to speak to one of the innovation hubs or test beds, your R&D team, or research and innovations teams, one of the innovation centres, or the knowledge transfer network. There are others. So we're able to signpost people to other bodies who will be able to help them when we're unable to help. So idea, is it a great idea? Is it an idea, or is it something that it sounds like a nice idea when you delve into it, that actually there's not much to it? Or actually maybe somebody else has come across and tried and had problems and not been able to realize it. Maybe you can. So it's establishing whether that's an idea is actually an innovation that's worth developing. And your problem solving, on a daily basis, pretty much in any role, and whether it's more patient facing, more administrative, working in a lab, whether it's in community, rehab, podiatry, whatever area you're in, you're going to be spotting those opportunities, and your best place to spot those opportunities to make things better, to make them quicker, more effective, identify cheaper options. So, we've got a robust process to allow us to identify those innovations that have the best potential. So let's talk a little bit through about how you can kind of capture that. So actually, this is another way to maybe look more visually at the innovation pathway, because the invention, evaluation and assessment bit is just the start, coming from, it's not as linear as this nice picture looks. We've got, starting off, coming out from or involving the NHS in Scotland, going through and hopefully, being implemented in NHS Scotland, but more widely, to generate a return and actually to fund innovations within the NHS as well. And we conform to ISO 13485, quality management system harmonised with the Medical Device Directive. So we've got expertise across the pathway, but also that enables us to design, develop products, protect them, and be able to license them to commercial partners who are, certainly with medical devices, where it's going to be a regulated, going into that regulated framework. And so those products are developed under an accredited regulatory framework. So describing your idea. need to think about, breaking it down. What is it? What does it do? How will it be used? How will it work? Where will it be used? Who will use it? And why is it needed? And you want to explain that in terms of clinical and operational need. When describing your advances and benefits, compare it with current practice. Is it that there's new guidelines that are coming in, it means that you're going to have to change what you do and change current practice and develop it? Or actually you've been doing the same thing for 20 years and actually think that you see a better way of doing things that's maybe just better, cheaper? Is it faster? Or in the case of the Saris Hood, very much an innovation from pandemic, actually looking at, well, is there a way we can make things safer? So allowing people to do CPR, first responders who don't have other bits of kit like paramedics might do, to actually be safely give CPR, keeping both sides safe. And key to establishing whether it's, would somebody buy it? Is it worth developing? Is to look at that. What's the problem? What problem does your idea solve? Is there really a problem? And can you quantify that problem? Other ways, how, as I say, how does it compare to current practice? Does it fit alongside current practice? Would you need a completely new pathway in order to introduce it? Replacing a drug with another drug in, like for like, maybe can be much more simpler than maybe a rehab program, which has a number of different members of multidisciplinary teams and things like that. Who's going to use it? Who's going to benefit? And we really want to sort of explore, is it a problem that's relevant just to you, to your service, to your community setting, your health board, your hospital or your ward? Or is it something that's actually, it's pretty generic and it can be used, something that might solve your problem will solve many. You might look at some of the portable ultrasound devices, for example, that that can be used in lots of different settings, rather than just being a big device that's wheeled around one particular area. And these ideas can be really simple. Helping somebody who's unable to hold their nose to staunch a nosebleed with the rhino pinch, or identifying that there's paramedics in the ambulance service recognizing that they couldn't safely transport children in the back of the ambulance or on trolleys, develop the ambulance child restraint, for example. So, and that's now in every ambulance across Scotland. So it's thinking about, what's it going to do? Is it saving time and energy, staff? Is it adaptable? And actually thinking about what can you quantify? So another aspect in whether the idea is, is there something about it is it really new? Is it something else? Is something else out there? Again, we're back to that. Is it faster, cheaper, better? Thinking about those things. Intellectual property comes in as a way to protect innovation. So as the name suggests, intellectual property is like other types of property. You can trade it, you can buy it, you can sell it, you can license it to other people. And in order for us to kind of assess that, that's why we're asking for a technical description, or we sometimes call it a technical disclosure, so that we can actually look at, say, patent databases, if that's about how it works. And I'm not going to go into any detail. Obviously, we've done a webinar before, but we're certainly happy to discuss any questions you've got. So, if they're relevant or generic, then, post them here, or happy to arrange an offline conversation. And also, these sorts of sessions, you can do it as a webinar, but we're very happy to do these sessions talking about intellectual property, innovation, ideas in general, with your teams. If that's something, do let us know if that's something that would be interest to you. So as I said right at the start, it's about, is there any NHS intellectual property already? Have you got a prototype you've developed, a special way of making your widget work? And also Have you talked to anybody about it? So secrecy is you often see that mentioned, don't talk to anybody about your idea, be careful. And the reason for that is if you're going to try and patent it, an innovation, then it needs to be not seen anywhere in the world. You know, not even a random publication that's only available in Argentina, as used to be the way, you know, how could, you know, it's not on any online database, for example. So that still could be used to stop you from patenting. And that's, you know, the games that maybe bigger companies play. But simply, you know, basically putting in non-disclosure agreements and not, you know, not talking to anybody outside your health board is good first step. And we've got agreements in place with the health boards to enable us to discuss with you your idea in confidence. Your NHS health board, your health boards will have their own intellectual property policy. Some have got innovation or research and development as well, to see about how the processes and what they would look at. And I'm showing one of Azure now own all the rights and have much further developed the articulated hand and other, you know, this is an early version where all the individual fingers move separately, developed by David Gow and colleagues within NHS Lothian, and that was one of the first spin-outs from back in the early 2000s. And it has there are a number of patents, and they continue to patent the novel mechanisms and ways that these, you know, these articulated hands can work. And recently, Azure put further investment into their Scottish base. I think it's in Livingston. So it's thinking about these are the sorts of things that we'll talk to you about, and the market opportunity. So if you're going to invest £50,000 in developing something, you need to be looking at how can you recoup those costs and actually gain a financial return, you know, to actually invest into the next idea and developments. I've given an example here of something that's actually very niche, but it doesn't cost massively to develop, and it doesn't cost that much, but it's very much has a global market for surgical trauma teams, and having the right information, right kit in the right place when you need it and time's critical, it's going to be key. So it's thinking about, you know, in your area, you know, is there a big market? Are there lots of different companies involved? You know, who are the current players and things that you'll know who you buy your products from, what you have. It's this, we sometimes talk about the customer discovery. So, you know, who's going to pay for it, who's going to use it, you know, who are the beneficiaries, who are the decision makers in the whole process. Certainly regulatory factors come into play with medtech. You know, how will you reach the market? You know, is it something you sell to a customer? You know, thinking about those sorts of things. And it's about thinking about, you know, also sometimes what market are you in? So you know, a bag that you use in an air ambulance is quite obviously a bag you use in an air ambulance, but you know, it might be that it's actually it's more a consumer product that you want to use in a healthcare setting. So it might need, you know, it might have much more potential in another environment. So it's thinking about some of these things that we'll talk through with you. And we really, well, you know, we'll need your help and input to actually, you know, get that understanding of where things fit within your area. And what I've touched on throughout has been a bit about, you know, what resources are needed, what expertise is needed. And I thought it helped to maybe just sort of summarize that a bit. You know, is the technology even feasible? You know, is it, you know, a really innovative, novel idea, complete new invention? You know, or maybe you've developed a prototype and you've been using, and you know, how much will it cost to develop? Have you any idea about that? No, you're not going to know all the answers to these, and that's absolutely fine. But these are the sorts of questions that we start to look at, because we have a limited budget, but we would also look to, you know, tap into other funding through our partners in Innovate UK and others. Also, you know, what expertise do you have? If you know, maybe you're the software developer and you really got great idea for a particular digital health app, but maybe needing more of your colleagues' input in some of the clinical aspects, or vice versa. There's obviously thinking about things like clinical evaluation, who would you work with to enable you to do that? And we're going to talk more about, the role of, how we work with our research and innovation teams, innovation hubs, at a later, in the new year. These examples are companies spin outs where there are either a number of different parties brought together, or more commonly is, say, for example, looking at Cardio Precision. It's a technology company. They're developing medical devices, for the treatment of structural heart disease and cardiothoracics. That was spun out of the Golden Jubilee, Glasgow, Greater Glasgow and Clyde, in Inniscot Health back in 2007. So, and that's still raising investment and developing and getting into used in practice. So where there's significant investment involved, more further R&D, clinical trials, regulatory approvals and things like that, that can be the case where you'd actually be looking at combining that and raising significant investment could justify a spin-out company, for example. But that's, it's less common. So hopefully that's given you a bit more confidence about describing your idea. So we're going to talk, we'll talk to you about your idea. It's like thinking about things in the current clinical operational context. We don't take every idea forward, but we really recognise that your specialty, your service much better than we do, and it's about building that understanding in case to establish what, how could you take that project or development forward, so that you're developing something that's strong commercially, and as I said earlier, that showing the potential health economic benefits. So these are kind of the key things we want to think about. And we obviously work with others, academia, industry, to take things forward. But this, we're focusing on that first start. And if you work for the NHS and you'd like to have a chat first, feel free, even for early ideas, you've not even really thought it far through. Happy to arrange a chat with you before you submit, but don't be afraid to sort of submit something without all necessarily feeling like you have all the answers. So I think that now would be a good time to cover some of your questions. Let me just stop sharing for a moment. So,
hi Fiona. So we've got a question about technical prototypes. I've made one, and how do I get it tested?
So I think there's probably a number of things that we would do first is finding out a bit more about it, who you developed it with, and where you think it will fit. If you've worked with your medical physics or clinical engineering team to develop it, that could, that might affect it. So that's could be one way. But happy to sort of have that conversation about, okay, at that stage. So if your idea is at the prototype stage, even further on, so I think historically, clinical academics were bringing ideas to us maybe, very much more 20 years ago, whereas I think because it might be, I think maybe we get more questions or more ideas coming from staff who aren't necessarily involved with that research and innovation or research development area now. So welcome ideas from all stages, because there are others like Medical Device Manufacturing Centre at Heriot-Watt and aligned to other universities and lots of different organisations we can kind of tap into if that's not the NHS to work with.
Another question that's came in is, does the idea need to be well underway before discussing and bringing to the innovation teams? I think that was a no, really, wasn't it? But
yeah, hopefully you've understood that we kind of answered that a bit already, in terms of, yeah, don't be afraid to come and talk to us if you've got questions. And even if you don't you feel, I mean, the idea behind today was to try and give you a bit more of an understanding of, we don't give you a quick answer, by return. We're looking and exploring and helping you develop those ideas with you. And also to enable you to get on with the day job so that we can actually, encourage and support you to be innovative in your day-to-day work, but actually then help develop those ideas and innovations further with you.
A question as well that's came in with regards to ethics and who's best to speak to about the ethics of new innovations and best way to move forward with that.
So it depends on what sort of question you have in terms of that. But certainly we work closely with, I'm certainly based within the Accord team in Lothian, working alongside the NHS and University, NHS Lothian, University of Edinburgh team who have experts in that area to understand, who would be the right person to speak to. So that's probably something. We've got some expertise, but it's more linking and working with your local research and innovation or research and development team.
And I think on that as well, Fiona, as a question came in about looking at developing of the products and is there an ability to test these products within the NHS?
So I think this is something that we are going to go into a bit more detail with Research Innovation and Innovation Hub colleagues in the new year, hopefully in February. So yeah, there's various ways that you might want to look at that, depending on where you're based, how much, how early a stage it is, whether, you're looking to not just test, but actually there's still some development work and there might be shared IP that might come out of that, for example.
Yep, and another one's came in with regards to funding, which we can help with, but I'll let you answer it. How do we get access to funding?
So I think it's all of those. Yes. So I think there's lots to be said about, there's lots of different avenues, ever smaller pots of funds sometimes, but in key priority areas there's more funds coming through. Yeah, I think it's just working out what lost my train of thought there. Sorry.
What's the best route, really? I think we can help signpost to different organisations with regards to funding.
Yeah. So I think it depends on whether it's going to be, how close to that translation into practice? Is it more about looking at clinical evidence, or, is it about a clinical trial? Is it earlier? Is it just looking at usability? There's such a range.
Yeah, no worries. There's another question that's came in, and it's are there any standard agreements in place for defining equity, revenue sharing, compensation for the innovator? Just realising that these projects take up a lot of time and input, and it's for a long period of time, and innovators are not always clear from the onset whether or how they will share in equity and revenue, etc. Yeah,
so I think that's really interesting, because most, if not all, health boards have an IP, an intellectual property policy, or some are developing their, maybe described as an innovation policy, which talks about the priorities. But certainly within most of the ones I'm aware of, they have a kind of a breakdown of that revenue share, they often call it, in terms of if there's a royalty that comes back to the health board, and how that's shared. So we've got, an arrangement so that we're looking to cover our costs, and then provide ongoing support for the projects that we're supporting the development of. But there's also, so in terms of when it gets to that spin out, if it's going to be a spin out in terms of equity, there may be other considerations in that. There are certainly innovation fellowships which have been put in place by the CSO more recently, in recent years, so that, giving people time to actually put, having a dedicated time, like a day a week, to enable them to sort of progress with their innovation projects. And I think that's where we certainly will, support making sure that that's clear about what that looks like for that particular health board. or, you know, that group of health boards that are working together, perhaps. Does that, hopefully that answers your the question.
I think so. And on a similar kind of a note, there's another one here that's when or how early should a company partner be approached? And I think that they're thinking about IP and the secrecy of patentable inventions.
So that's, I guess, what I was trying to allude to in terms of why we talk about intellectual property. We talk about secrecy. We often talk about confidentiality agreements or non-disclosure agreements. So pretty much the same thing. And it's about making sure, like, that both sides understand that they're sharing, you know, valuable information that's not in the public domain. So we can help, or, you know, certainly make sure that you're talking to the relevant people within your research and innovation team, within your health board, to make sure that there's a non-disclosure agreement put in place, so that you kind of protecting that, and that we would say you should do that whichever, you know, whenever you're going to talk to a new industry commercial partner, or really anybody who's out with your health board. I know there's a bit of that sort of expected as assumed trust and confidentiality between NHS staff, but I think it's good practice to, when you talk to an external party, you know, that's something that we can, you know, help you put those in place. I mean, I think that's pretty much standard fare. We have standard agreements, as do individual health boards have that as well. And that's sometimes something we can kind of help you with those conversations. It's not necessarily that we have to be taking on those projects, but we're able to do that to support you with that, and think about some of the questions you might want to ask, so that you're not signing away your IP, or, you know, because I think it's just, I think we often talk about intellectual property in general terms, and it's not always about a patent. It could be about a design. It could be about your, you know, copyright material, and actually your knowledge and know-how, and actually recognizing the value of that, because that I think is where, you know, that's why people want to work for the NHS, work with the NHS, is because it actually, they also see that as being an accreditation in a way, without having to pay for that sort of recognition. It's almost implied recognition by working with the NHS. So there's, you know, getting some recognition, you know, some sort of value recognition, or, you know, there are lots of different ways. It isn't always about a revenue share, or, you know, it isn't always about money. It might be about, you know, the NHS. It could be more important that they work with an industry early on, so that they get discounted products, or they get, you know, they get a longer license to actually help with, you know, ironing out problems with early adoption and things like that. So yeah, there's lots of different ways, and we can support those conversations.
I think that's the questions I've just asked in the chat. If there's anyone else that wants to ask any questions, please feel free. I think there's always a debate on what's novel and what is quality improvement, or things like that that maybe come up during conversations about innovation.
Yeah, and so, I think don't be afraid if you're not sure, because if we can't help, we'll hopefully know somebody who can. And yeah, I think that it doesn't do you, you know, the cost of half an hour of a chat, and we hopefully would be able to put you in touch with somebody else who can help you if we can't directly. Well, if there aren't any other burning questions, I mean, I appreciate there's, you know, hopefully you'll have ideas that you can share, and this will help you see how we sort of take it further forward. And apologies, I'm trying to share my screen and I'm failing. Before we go, I'd like to sort of say kind of just a bit of a recap about our webinar series. So the last one of this year is going to be coming up in November, Interconnected Innovation. healthcare learnings from animals and the environment, and then we'll having a break in December to return in January. And as I say, part of that will be including, you know, what can you do next, and how do you, you know, who do you talk to about ethics, or, you know, oh, I think I'll need a clinical trial. What does that mean, and who do I talk to, and things like that. Also, our past webinars are on demand on our YouTube channel, and we're really keen to hear who'd like us to be speaking to. You know, what would you like us to cover next? And certainly appreciate you know, any questions that you have. Don't be afraid. So we've set this session up today to kind of help you see. So there's quite a lot goes on behind the scenes when we're trying to explore and assess new ideas. But we don't want to put you off actually coming and submitting, or you know, making an appointment to talk to us. And do keep in touch. So we are, you know, obviously on various parts of social media with Twitter, or we haven't updated it to say X, apologies, and LinkedIn, our website, and you know, good way to keep in touch and hear about the latest events, webinars and activities. We're also including things like funding and other things that are happening in our newsletter. So you're welcome to sign up. It's on the bottom of our website pages, but also feel free to scan newsletter and sign up there. And like to just thank you all for your time. Look forward to receiving your ideas forms, or to meeting you soon at one of the various events ongoing this autumn. Thanks very much for your time.